Hi, and welcome to Module 5, Lecture 2. This is our last lecture for Introduction to Community Health. Last week, we had our first lecture was going through a presentation that Pierce County Health Department made about their needs and assets assessment. So this week, we'll be looking at it page by page, section by section, going through the very details of your reading for the last 2 weeks for this module, which was the Tacoma-Pierce County Community Health Status Assessment from 2013. So they started with Vision for a Healthy Community. So what was their vision? Basically, it was equity, which translates to, as per the community's voice, adequate transportation, employment, housing, education, safety, and delinking of socioeconomic status or financial matters from health. So basically delinking poverty from health. And that's a big one. I put that in bold just to get an idea that this is one of our big picture equity goals in any community health project or endeavor. So what else did they say? Healthcare cost allocations are improved to insurers and employers, probably as an incentive to insure more people. Reduced barriers to free or low-cost healthcare for preventive and acute care. I think that's important because we see a lot of people coming to the emergency room who need acute care, and if they had had preventive care, it wouldn't have been maybe gotten to that point. So that's an important one. Enhanced continuity of care through community-based services. Some of you are working on this for your final projects, this kind of concept, which is really great. A healthy environment. They said, basically the community said, equals or amounts to the availability of healthy foods and recreation. Communities incorporate the whole person to live, learn, work, worship, and play. And that's an important one if we think about the right to practice a religion, both historically because of sort of indigenous rights or African diaspora rights to practice their own religions and rituals and their own music and culture. So that's been historically prevented in this country, but also more recently, sort of Islamophobia, which is the fear of Islam and Muslim worship because of its loose association with political problems. So that's another point of equity that's worth considering when we look at mental health and spiritual health. Policies oriented to and support health promotion and disease prevention. We've seen, if you remember Don Warren, Dr. Warren, who had been featured in one of the Unnatural Causes videos about environment and diabetes earlier in this course. He had suggested that many of the health spending dollars in and around the Pima Indian Reservation were in end-stage diabetes care, dialysis centers, and surgical interventions, amputations, which are really diabetes at its most advanced stages. And he was talking about why are there not investments in physical education, in healthy food, school lunches, and those are things that were actually addressed in our Tacoma Pierce County health status report. So we'll get into that into the next few sections. And then threats to health are minimized. That was another vision for the healthy community. Air, water, land, and emerging risks. This was another important one, and we'll talk about this too in a bit. So there's another vision. There's a lot of visioning and big picture ideas in these kind of sort of initiatives and collaborative works. So another vision was for an organized health system. Healthcare systems recognize and work with upstream social determinants of health, as we've been exploring in this class. We have food, water, transportation systems, increased focus on populations rather than individuals. And that, if you think about this, that's a radical idea in some ways, because we're moving away from sort of individual responsibility and maybe more of a blame kind of paradigm of, if your health is bad, that's because you didn't take care of yourself, to what did you have access to as a young person, as an adult? Have you had to choose between spending money on medicine or healthcare or food and something else? Have you been without basic needs for some time of your life? So we're moving more into looking at determinants of health at the population level or community level, which is sort of getting at those fundamental causes or upstream social determinants. So there is a broader scope of partnerships actively engaged with improving coordination and minimizing duplication of efforts. And as we saw in our emergencies module, this is really important in emergencies, but even in regular health planning. So this is really important. So then we have healthcare systems use evidence-based practices, but allow for innovation to organize, engage, and change. Why is this so important? You've seen during your own exploration through this class how important it is to find proven or evidence-based interventions rather than ones that are promoted by other entities that might have a conflict of interest, that might have be backed by sort of political agendas. So this is important for transparency and for having a patient-centered health system. So the healthcare system, including public health, has clearly defined practical roles for all partners. And this is a big part of improved coordination and minimizing duplication efforts. So that's another vision for Tacoma Pierce County Health Department. So these key questions were very important. Where data are available, what has worsened, what has improved? What are unique health needs of our underserved residents? What are the health disparities in our communities? What stories about our residents and their health are important to tell? And what are Pierce County's strengths and assets that contribute to good health? So now we're looking at data. We had a mix in this report of primary and secondary data. We had primary data, which was directly collected from citizens of Tacoma Pierce County by the Community Health Status Assessment team. Focus groups, which were groups of individuals who came together. They were given discussion prompts, but basically it's a qualitative research method where they were not asking survey questions that were predetermined and had sort of a multiple choice response. They were asking more open and free questions about needs and about challenges and about strengths in Tacoma Pierce County. So community workshops, same thing, qualitative research into challenges, strengths, needs, and assets. So secondary data, you've been working a lot with secondary data in this class, and for those of you who are in community health advocacy, all your wonderful skills in citation and referencing was from all of the secondary data. And hopefully you'll get to collect some primary data in your future classes, maybe in research or health promotion. But secondary data were from large data sets such as BRFSS, BRFS, and the United States Census, and Healthy Youth Survey, and other such kind of larger surveys. They're also from peer-reviewed journal articles and any other existing source of data that was not specifically collected for the community health status assessment. So the data for this sort of shows you, here's a little schematic, that there were secondary data, there was focus groups, key leader focus groups, community workshops, and there was a survey that the community health status assessment group did. So many sources of primary data and also secondary. So what were the big picture assessments? Forces of change was one of them. And the major questions in this assessment were, what is occurring or might occur that affects the health of our community or the local public health system in Pierce County? What specific threats or opportunities are generated by these occurrences? The other big picture assessment was local public health system assessment. And that was more about the questions such as what are the components, activities, competencies, and capacities of our local public health system in Pierce County? What are the gaps in this system? So if you'll notice, partners and key partners, there were many partners, and that's the sort of, you can recognize a good community health status assessment or community health assessment when you see this many partners. That means they're aiming for full representation of the population, whether it's majority groups, minority groups, age, gender, race. They're trying to cover everything. So this is actually the sign of a really great assessment. So they have Centro Latino, City of Gig Harbor, Puyallup, Lakewood. They have Cross-Cultural Collaborative, Franciscan was a key partner. They have JBLM, Korean Women. Multicare was another key partner. They have the library system. They have Tribal Health Authority of Puyallup, Rainbow Center, CMAR, again, Tacoma Pierce County Health Department, key player. Black Infant Health Program, since they saw that this was one of the key birth outcomes in the African American Black population was one of the major disparities. So they specifically chose this group, which I thought is a brilliant idea, to find out real needs and hear it from the community itself. They have nurses, family partnership, they have the Board of Health, Tacoma Public Library, and UW Tacoma was another key partner in data collection. So the summary of the key findings were that crime and violence are important health concerns impacting the residents. Most deaths in Pierce County are from chronic diseases. Smoking and obesity continue to plague residents. A large proportion of adults and youth suffer from poor mental health. Residents of low income and lower educational attainment, as well as Black residents, experience worse health outcomes. Health disparities impact non-white residents too. Substance abuse is an important health concern impacting residents, and lack of access to healthcare was identified as an issue having the greatest impact on health. So we'll see you in the next part of this lecture and enjoy the reading.